What about health and economics you think is interesting, and why such a focus in that area now?
Interesting. So, a lot of what has driven my work has been how I grew up, where I grew up, what I witnessed growing up. And so, growing up in the 80s and 90s and seeing the crack epidemic and seeing where it predominantly resided and who it predominantly affected. And, as a child and in the 90s, crack using drugs was considered an addiction. And I remember in grad school, I started working on a lot of my current research when I was in grad school. It was loosely related to my dissertation, but when I was in grad school, the opioid epidemic started. And the verbiage around drug use then became substance abuse or substance use, and it became a health infliction opposed to a personal choice. And to me, I agree with it 100%, but I started to think about, well, what about those individuals from the 90s or 80s where it was considered a personal choice, and as a consequence, people went to jail. We had a lot more single-headed households. We had a lot more children in the foster care system. And so what I think sometimes when people think economics, it's always, well, should I buy or sell stock? Is the housing market going to go up or down? What's happening with inflation? But really, when we think about economics, there's a lot of other factors that influence it, and health, substance use, mental health is a big component. If you are dealing with substance use or mental health, you can't contribute financially to your household maybe the way that you typically will. Your production goes down. And this has a trickle effect right down to your children. And now if one parent is working a double job or is working two jobs or a double shift, what happens to the child at school? What happens to, we talked about parental involvement in schooling. And so I think it was a much more, what's happening and what has happened to populations, underserved populations, underrepresented populations, is much more complicated than just working or not working. It's much more complicated than going to college or not going to college. And I think health and understanding the role health plays into it. And while I do mostly mental health and substance use, even, whether you get screened for prostate cancer early or not, given that for Black men, the rate of prostate cancer is much higher. Whether you're aware of this information, when people think about misinformation and some of the choices individuals that are Black or Hispanic make when it relates to health, I remind my students, my oldest sister was born when Tuskegee experiment was still going on. It is not that far removed, right? So when you wonder why some people maybe feel a bit apprehensive to go to the doctors, it's not simply because they're ignorant, right? There's other things built in that maybe white populations or the majority don't have to deal with. And so I think it's really important to expose what's happening. And as you're aware of, and as most people are aware of, there's not a lot of economists of color. There are not a lot of Black economists, which in turn, there are not a lot of Black health economists. And so making sure that someone that has this experience and this lived experience can add some insight into what may be happening, or just add a different approach to investigating how policies or how choices may be impacting the health of communities of color.